If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
According to the National Institute of Mental Health, over 16 million adults age 18 and older in the U.S. had at least one major depressive episode in 2015. That's 6.7% of all American adults, and the numbers are increasing. The good news is that there's hope. We'll talk about what depression really is today, and we'll look at a potentially revolutionary FDA-approved treatment to help patients for whom talk and drug therapies alone have not worked. We'll also discuss how a holistic approach to depression, one that involves diet and exercise, as well as prayer and meditation, can contribute significantly to healing a troubled mind. That's all coming up next on To Your Health. Depression has been described as the dark night of the soul. And for many people, that dark night can last for weeks, months, or even years. An estimated 350 million people worldwide suffer from this often debilitating condition. Joining us today to talk about depression and a revolutionary new treatment called transcranial magnetic stimulation, or TMS, is Dr. Andrea Carlsen. Dr. Carlsen is on the faculty of the Psychiatry and Pediatric Department at Northwell Health System. She's also the medical director at North Shore TMS. One of the early adopters of TMS for depression, she has been treating patients since 2010. Dr. Carlsen, thanks so much for being here.
Thank you for having me.
So I feel like we know what depression is, right? It's sadness, it's being blue. But as a doctor, can you give us a more sort of clinical explanation of what depression really is?
When we look for depression, we think of it, and it is a medical disorder in which people have changes in the way they feel and in their physical health. So people report feeling sad, they no longer enjoy things, they have changes in their motivation, their energy, their sleep, their appetite, they have thoughts of and feelings of helplessness, and they may even have suicidal ideation with clinical depression.
And that's what I was going to ask about. So the difference between just sadness and being clinically depressed is what?
You know, I think all of us feel sad at different times. We don't like it. It's hard, right? But it's part of what it is to be human. We may have it for hours or even days. But if a depression and those symptoms are persisting for weeks, 2 weeks or longer, and it's really impacting people's quality of life, their relationships, their work, their children, their spouses, that is clinical depression.
And why is it on the rise in this country and also around the world?
Around the world, you know, that is an interesting question. It's really multifactorial. If you look at the symptoms of depression, it's remarkably consistent for the past 2,000 years, since the age of Hippocrates. Incredible. But in more recent studies, they really indicate a rise with the increase in modernization. So all of the things that lead to poor nutrition, which is a huge one, not moving, sleep disruption, less light, all of those are leading to an explosion in chronic disease.
And I wonder if social isolation also has something to do with it.
That's a big one. I agree. It's a huge one. And those factors come together to contribute to chronic illness, and depression is one of those illnesses.
Is there a genetic component to depression?
There is. And so we know from family history, if you have an identical twin, you'll have a 50% greater chance of having depression. If a parent has depression, you have a 25% greater chance. So we know that it's a biochemical disorder with a genetic contribution.
Mm-hmm. Now, can children become clinically depressed?
They can. Really, people from young children to the elderly can become clinically depressed. About 1% to 2% of young children, 5% of adolescents will become clinically depressed. It's even between boys and girls, interestingly, until adolescence, and then it becomes more common in girls than boys.
Why do you think that is?
There's probably a number, and there are a number of reasons for that. Certainly one is hormonal. If you follow women out across the lifespan, they're twice as likely to become depressed as men. So after being in the postpartum period, in the menopausal period with the change in hormones, that also impacts our neurotransmitters.
And going back to children, so they can become clinically depressed.
You can.
What can you do with a child who's clinically depressed to kind of nip it in the bud so it doesn't become clinical depression as an adult?
Yes, and thankfully there's a lot we can do. We can do talk therapy. There's a lot of data for that. So either cognitive behavioral therapy, interpersonal therapy, get them moving. Right? There's a recent study that was out that active children have lower rates of depression. Nutrition is huge. So get the bad stuff out and put the good stuff in.
Do you think sugar makes us depressed?
I think sugar is bad for our bodies and bad for our brains. And our brains and our bodies talk all the time, right? There's really no separation between the two. For children, family therapy is really important. So making sure that there's good communication, that the conflict is low, that people are connected to their children. All of that is really important. There are some instances where medication may be appropriate for children and adolescents, but it's not the go-to recommendation, and it's not a standalone treatment.
But the most common therapies these days for depression are talk therapy and medication for adults, yes?
That is true, absolutely. And there's good data for both. And the best data really is a combination of, for moderate to severe depression, medication and cognitive behavioral therapy.
But I'm sure you'd agree that for some people, they're going to a therapist and they're taking medication and it really isn't helping. There is a percentage of people for whom it doesn't make a difference. So what do you do in that case?
In that case, we look at other things. First of all, we want to make sure we haven't missed anything, right? Do they have comorbidities that are not being addressed? Anxiety disorders, substance use disorders. How is their nutrition? Are they exercising? Also, if they have failed a medication, then transcranial magnetic stimulation, TMS, can be a great option for them.
And that's something that I mentioned when I introduced you. So transcranial magnetic stimulation, I had not heard of that before I started preparing for this show. So in a nutshell, what is it?
TMS is a non-medication option for the treatment of depression. It's actually been approved by the FDA since 2008. It's been around for decades. And for people who haven't done well with medication, it is very effective. There's an MRI strength magnet that puts a very focused pulse into parts of the brain and stimulates the parts of the brain that are underactive in depression.
That's amazing.
It's incredible. And it's got a great side effect profile because it doesn't have to go through the body. It's very focused to the brain. So we don't have weight gain, people don't get tired, they don't have dry mouth, the things that people have to manage sometimes on medications.
So we're going to be talking about that a little bit more after the break with one of your colleagues.
Okay,
Yes.
wonderful.
When we come back, we'll dig a little deeper into transcranial magnetic stimulation. Dr. Carlsen and I will be joined by her colleague, Rose Molfetta, the TMS coordinator at Northwell Health System. Stay with us. Welcome back. Today we're talking about depression. The most common ways to treat depression are medication and talk therapy. But what do you do when those approaches don't seem to work and you're still as depressed as ever? We're here with psychiatrist Dr. Andrea Carlsen and Rose Molfetta, a licensed social worker. They work together at North Shore TMS. TMS stands for transcranial magnetic stimulation. It's a promising new high-tech treatment that's been approved by the FDA and has been shown to be effective in treating patients with severe depression. Thanks so much for being here, Rose.
Thank you.
So I want to talk to you in a second, but the first thing I want to do is just come back to you for 1 second, Dr. Carlsen, because we were talking about it before the break, and just get at, so what do these magnetic pulses do to the brain, and how does it help people with severe depression?
So it's a very focused magnetic pulse, and it's a rapid series of pulses that goes on 10 trains over 4 seconds, so 40 pulses. And when it penetrates the brain, it generates a very focused electric current in the part of the brain that is underactive in depression, as well as deeper parts of the brain that are underactive in depression. And when that occurs, neurotransmitters are released, more glucose goes to the area, more oxygen, and that, when the brain wakes up, that correlates with a decrease in depressive symptoms.
So you're a licensed social worker and you work with Dr. Carlsen at North Shore TMS. How do you work together? What's your role?
Well, I am the TMS treater, and as a social worker, when the patients come in, we evaluate the patient in the onset of the treatment. We do a lot of scales, and which are testing to see where their depression lies in their baseline. So every day I'm performing this technique, and we see results day by day, and then I report to her if there's any changes or if I see anything with that she may have to be alerted to as far as the depression or anything that I have to report to her regarding, any of the patient's needs.
So what I'm trying to understand, because I'm trying to get a visual on it. So you're sitting in a chair, you're underneath a machine that's kind of like an MRI, and is it touching you? Is there physical contact? You just sit there? Like, describe the treatment to me.
So it's a dentist chair, very comfortable. And the patient is tilted back, and a rectangular magnet, a container that contains the magnet, is placed lightly on the left side of their head. And they are talking or reading, talking to Rose, listening to music during the treatment. And it lasts 37 minutes. And during that time, they're receiving the pulses. There's a train where they just wait, and they go through that for 37 minutes until they receive 3,000 pulses. There are about 30 sessions per patient, give or take. Some people need a little less. Sometimes people need a little more for the resolution of the depressive symptoms.
And what do people report feeling when they're sitting there in the chair? Do they feel anything, Rose?
I think it's, from my experience in working with the patients, I really think it's a place where they just feel like it's a safe place to come in for maybe 37 minutes, depending on, how long that treatment is, if it's, a single treatment or bilateral. But they're just like really resting and really just taking it in because.
So they're not really feeling it?
No, they're not reporting. I mean, sometimes they may say that they feel, some type of sensation, but that's really in the initial, in the beginning. And then after that, I feel like with the patients that I've worked with, they really feel like, they come in and they're not really having any side effects whatsoever. And they really get good results from it.
When
So
they
it's not
first begin
painful?
the treatment, though, and during the treatment, you hear a clicking sound, which is the sound of the magnet. And patients describe it as a tapping on their head. That's what it feels like. So they may feel some discomfort initially in the first couple of treatments on the side of their head, some scalp discomfort, and then the scalp becomes desensitized.
And no real side effects to the treatment?
The most common ones are discomfort on the scalp, maybe a mild headache after treatment. Can take a little Tylenol, that resolves. The biggest and rarest risk of TMS is risk of seizure, which is actually less than a psychiatric medication. So it's a very rare side effect. And that's one of the benefits of TMS, is that it's so well tolerated.
So how do you, you're a licensed social worker, so are you coordinating TMS treatment with talk therapy? Do they work together?
Well, it just depends if the patient, sometimes they come in and obviously they know they have their own therapist. So I work as, comprehensively with their team. So if they are reporting, as a social worker, what we do is that we're always looking at presentation, right? So when a patient comes in, how is their mood? And a lot of times they'll come in and they'll say, I'm having a terrible day, something happened. And then we might use that opportunity through the TMS treatment to maybe talk about that. But I'm very careful with, keeping those boundaries, because if they do have a therapist, I want to just support the therapy that's already given by another therapist. So I'm very supportive to it. I will do some skill building, depending on what the patient needs at that time. And other times they just want to be quiet. They don't want to talk, even if they are in a depressed mood. Sometimes that's what they need, that they just need to talk. And then I'm supportive as well. And just, how do you feel now? Do you want to talk now? And sometimes like, okay, I'm ready to talk. Or they'll say, no, I just want to stay quiet. And then that in itself, even from my training, that the silence sometimes is very therapeutic, because someone, a lot of times patients just need to know that they're supportive. Depression is a really dark place. And just to have someone sitting aside you that is saying, okay, I'm here if you need me. And if you want to speak, I'm here. And if if you don't, it's okay too. So that's the presence I like to bring into the TMS, because I think that it's a journey that is very dark. And, depression is very dark. And just to know that someone cares, right? Even as a licensed professional, and of course, as a person, I care. And I think that makes the world a difference, in the support team. So
Now, I know, Rose, that you were named in 2013 National Catholic Social Worker of the Year by the National Association of Catholic Social Workers. So obviously, faith and prayer are important to you. And I'm wondering, how do you, what drew you to the association, and how do faith and prayer, how can they play a role in the treatment of depression?
Well, when I was studying, I went to Stony Brook University. And when I was studying a master's of social work, I would say a lot of times I would be in class say, wow, you know what? This is like a God's ministry, social work. We're here to help people to help them rebuild their lives. And I had said to myself, wouldn't it be great, if there was an association that incorporated spirituality with the standard clinical training? And lo and behold, I was at a conference speaking, and I met Kathleen Naher, who is the president of the association. And she said, she stood up and said, I am the president of the National Association of Catholic Social Workers, for anybody who'd be interested in maybe, understanding what the joining of the two methodologies are. And I was very interested, and I got involved. And it took you to another level as a social worker, a much deeper level, because as someone who's helping with clinical information and education with the spirituality, and having some of the great scholars of the church and speaking and psychologists and doctors and deans that are instructing us on how to incorporate this into our practices. And for me personally, I know, and I can say this, honestly, I know that when you incorporate prayer into your situation, miracles do happen. And I'm a firm believer of it. I've lived it. And now in my practice and with Dr. Carlsen's patients, if they don't believe in that, and that's fine, because anybody can come, but you can, just have the heart to say that this is someone who is coming through our doors that, has been entrusted to us to help, to regain their life. And that is just a beautiful responsibility that I think that God has given, social workers to do, to help people to move on with their lives. And for those who are open to it, incorporating it and praying with them and helping them to kind of look at things from, a faith perspective, that
You can't underestimate the power of it.
there's always hope. And depression is despair. And faith says there's hope. And we don't have to say that with words a lot of times. We can just say that by our actions and really trying to help that patient to see that there is hope.
Well, I want to thank you both so much for being here today. Thank you. Coming up next, we're going to talk to Martha Rhodes about how TMS, combined with a holistic approach that includes diet, exercise, and meditation, actually saved her life. We'll be right back. Welcome back. Martha Rhodes was a successful advertising executive, wife, and mother who seemed to have it all. That is, until she succumbed to depression and attempted suicide. Drug treatments didn't help, and so she turned to TMS, transcranial magnetic stimulation. Today, Martha no longer lives under the weight of depression. She's an international TMS patient advocate, and she also wrote a book called 3,000 Pulses Later, a memoir of surviving depression without medication. It's so good to have you here.
Thank you for having me.
So I was saying, you had it all. You were this successful advertising executive, and you had 2 great kids. You had a long-term marriage. What brought you so low?
That's the $64,000 question, because everyone was shocked. No one could have been more surprised than I, though, to end up in an emergency room with a suicide attempt. It had to do with the levels of stress, sustained stress that I had over many, many years in career. But also, when I was a teenager, I remember having these feelings, these dark feelings then as well. So it's a clinical problem that wasn't diagnosed till I was in my 30s. But in the meantime, I'm raising 2 kids and having my life, and I just didn't know how ill I had become. So in the meantime, I finally succumbed.
And what kind of treatments, while you were raising children and you were starting to feel the weight of depression hit you, what kinds of treatments did you try?
Well, I did have a talk therapist, but I'm a stoic, and I thought, no, you got the world. What more could a girl ask for? So just get there, get up and do your job.
Get through it.
Yeah, get through it, which is what a lot of people with depression will do. And unfortunately, not realizing how sick you are, you go down a slippery slope, and next thing you know, you're trying to kill yourself, which is not a good idea.
Did you take medication?
I did take medication, and they worked for a while, but the side effects were brutal. So I took myself off of the medication, realizing, oh, I guess I have to go back on. With the second one, I actually kept going up and up the dosage. And finally, my doctor said, I can't make it any higher. At that point, I should have sought a psychiatrist. I was going to a GP. If I had gone to a psychiatrist, maybe things would have been different. But unfortunately, I had become treatment resistant, and I didn't know it.
So you attempted suicide, which is scary and horrifying. Was it at some point after that that you found out about TMS?
Yes. When I came out of the hospital, we went on what I call the medication merry-go-round. I went on 4 or 5 different combinations of medication, and not only did I not feel better, I felt worse, and I also just couldn't handle the side effects.
You said in your book that you went from a size 8 to a size 16,
Yeah.
which is enough to make anybody
I was
depressed.
very depressed about that too. So in the meantime, my sister happened to see, I finally said, I'm coming off these medications. My sister found an ad in a magazine for TMS. And she called me and she asked the receptionist in the doctor's office, she said, can I take this? She faxed it to me. I was on the phone. I got an appointment and I became, I was a candidate. I was a
Prime candidate.
prime candidate for TMS.
So
yeah.
what were those treatments like? What did they feel like? And how long were you on it?
It's surprisingly easy. I mean, you sit in a spa chair. It takes longer to get a manicure pedicure than it does to get, a treatment, quite frankly. But you have to commit. You have to go 5 days a week for 4 to 6 weeks. And because it's not a quick fix, it's cumulative. It starts at the outermost part of the brain. The neurons wake up. They talk to the neighbor neurons that go deeper, deeper into the brain. And eventually, for me, it took about 19 visits. I woke up on the 20th day after I'd started TMS, and I realized, oh, something's missing. And all of a sudden I thought, oh my gosh, what's missing is that disgusting, dread feeling that I have to do another day. And at that point, I thought, oh, maybe this is what they were talking about, the lift, the TMS lift. I call it emotional nausea, that most disgusting, hopeless feeling.
Wow.
And
So it felt like a cloud sort of lifted.
yeah, cloud, it's a lift, but it's subtle. It's subtle, but it's unmistakable. You can't describe it. It's not this big dramatic aha moment. It's very easy and very clear that, oh my goodness, I'm going to be okay. I'm going to make it through this nightmare. Yeah.
So TMS was one of your tools, but you also talk about the fact that you incorporated other tools like diet and exercise. Do you think that they enhanced the effectiveness of the TMS?
I think they did. For anything, I was participating. I was doing something to help myself because, again, this TMS is a tool. It's not a cure. And so for me to then, get out there, walk the dog, make sure I got plenty of sleep, stayed away from toxic people that were discouraging.
That's a good point.
Making sure that I stayed away from stressful situations. All of that contributed to supporting the technology, if you will, of this tool called TMS. But if I hadn't done those things in my heart, I believe I still would have been relieved with this treatment.
Another component, though, of your healing process was meditation.
Yeah.
And you're smiling when I'm saying that. So it lights you up, meditation?
Well, it does. It's a discipline. You got to remember, you have to do it. But the thing of it is, I look at it like a nap for my soul because I get in touch with my spirit. And being in touch with my spirit gives me a sense of worth. And I also, my analogy is it's kind of like when you take heavy, tight boots off and you put slippers on your feet. It's that kind of a relief after the meditation. There's this comfortable feeling that comes over me. So yeah, meditation's a big part of it.
Do you feel healed now?
Healed wouldn't be the word. I would say I feel relieved. I feel released from the shackles of this horrible illness. I feel okayness. I call it okayness because I wake up and I think, yeah, okay, I can do today. Yeah.
That's lovely.
Yeah.
So in a nutshell, as we're closing up here, what would you say to someone who is suffering from a severe bout of depression and is considering TMS, but is kind of like, I've tried so many things, why is this going to make any difference?
Well, it's easy to say have hope, easier said than done. My advice from the calls I get from and emails I get from people all over the world, own it. Own it that it's an illness, a medical illness. Do your part. Find the tool that works for you. If it isn't TMS, if it's medication, if it's ECT, find the tool that works for you. Do your part, and show up. Show up for whatever it is you've got to do to to come through these horrible, horrible episodes of depression.
Well, it's been a pleasure talking to you. You're an
Thank you.
inspiration.
Thank you.
That's our show today, everybody. So remember, faith, hope, and yes, love are stronger than depression. Hang in there, get help, and believe that your best days are still ahead of you. Till next time, here's to your health.